So men coming in with erection issues often don't realize that 90% of the time this is primarily a physical problem. The breakdown in terms of where the problem can be is that 90% of the time this is a circulation problem, getting and holding the blood. It can be a neurologic problem. It can be a hormonal problem, and it can be a psychological problem. And it can be a combination of all four of these. When men come in, often they feel that this is psychological, that if they could just stop worrying about it or stop thinking about it, they would get a good erection. And the bottom line is, unfortunately, it's mostly physical at that point. They could be ultimately, in the most exciting situation, and they still wouldn't get a good erection. And one of the issues we have is that many times the partners feel rejected. They're getting older, they feel maybe they're less attractive, maybe their partner is less attracted to them, and so they're convinced that it's really a psychological issue for their partners. And I actually encourage the partners to come in for this evaluation because it's very useful. So for the partner, it really does help them feel like, oh, it's not that he's not attracted to me, it's just this is a physical problem. And that can be very useful for them to know and make them feel much better about themselves and about their partners. Some of the women come in and they're sure that their partners are having an affair because he's just not getting good erections with them. And most of the time that's not true. The guy just can't get a good erection.